Welcome back, OSHA Life Safety Trainings. So we was discussing about the common hazard. One of them is the hand-arm vibration syndromes, which is the more danger and mostly we are facing once we are doing construction work or other like repetitive task as well also, or any vibrating tools which can generating the more vibration. Hand-arm vibration syndrome (HAVC) is the medical condition caused by the prolonged and repeated exposure to vibration from the handle, power tool to machinery. It affects the blood vessels, nerves, muscles, and joint of the hand and arm, leading to symptoms such as numbness and tingling in fingering and hand, loss of the grip strength and dexterity, blinching, whitening or fingering, also known as vibration, include white fingers, pain and discomfort, explosion in cold damp of condition. So vibrations is danger for our like bones because our joints having the lubrication there as lubrication made by the god, that lubrication creating our body system. It has limitation creation like age 30 or 40 our that lubrication creation is more high, and after that its creation will be reduced. That's why the persons who are going the old age that feeling the pain due to less creation of that lubrication in our joint. So once we are using the vibrating tools, so our lubrication using more than normal. So for that generation we have to take a must break to reset our that creating system. If we are continuously doing the work with the vibration tools and not stopping, not taking the rest appropriate, then our lubrication system will reduce creation and it will be soon young aged we can face the pain in our joints. More hazards about the vibrations are here. Hand arm vibration are risk factors: frequency, strength of the grip, duration, frequency of the exposure, low temperature are individual factor. Health effect: tingling, pains and needles, blinching of finger, swell of joint and loss of the desire to touch. Assess the risk to imply exposure to vibration, eliminate or control the exposure to level within the regulations, exposure limit action values, health monitoring to be established for those who could be harmed, provide information, instructions, and training to imply to operating the tools which is having more vibration. So we have to use the less vibrating tools. We have to use the proper leather gloves. It will reduce the vibrations. We have to give the proper like rest breaks to workers. Then as well as we have to take care medical test there. We have to do regularly their test mostly in the joints. If they are feeling the pain, then we have to change the workers or maybe we have to change their job. So this kind of the more control give us the better control on our hand storm variation syndromes vibration tools. So let's see one video about that.
Sempre que utilizar um equipamento de serviço com alimentação por bateria, a vibração pode afetar suas mãos e braços. A exposição prolongada à vibração pode causar alterações permanentes aos nervos, vasos sanguíneos, músculos e articulações, e pode levar à síndrome de vibração mão-braço, ou SVMB, o que pode levar a uma incapacidade grave. Os sinais e sintomas precoces de SVMB são formigamento, dormência e fraqueza nos dedos das mãos. Se sentir qualquer um desses sinais ou sintomas e se eles persistirem, interrompa seu trabalho, informe seu supervisor e obtenha assistência médica. Você pode estar em risco de desenvolver SVMB se precisar utilizar regularmente equipamentos de vibração, e quanto maior for o período de utilização e a frequência, maior será o risco. O mesmo se aplica se você trabalha segurando peças que vibram enquanto são processadas por equipamentos de alimentação. É importante avaliar os riscos antes de começar. Uma avaliação de risco deve considerar se o trabalho pode ser feito de forma diferente sem o uso de ferramentas e equipamentos vibratórios. Se precisar usar ferramentas vibratórias para realizar seu trabalho, deve ter certeza de que é a ferramenta certa para o trabalho e de que recebeu a manutenção apropriada e está funcionando de forma eficiente. Se possível, use as ferramentas com baixo nível vibratório. A avaliação dos riscos de vibração mão e braço deve também levar em conta por quanto tempo o equipamento pode ser utilizado de forma segura e quanto tempo de intervalo deve ser feito. Quando estiver trabalhando, certifique-se de estar aquecido e seco, se possível, principalmente suas mãos. Além disso, se possível, faça uma pausa, não utilizando a ferramenta direto por um longo período de tempo. Não force a ferramenta ou a peça mais do que o necessário e, quando terminar, certifique-se de guardá-las e armazená-las adequadamente. Você está preparado?
So that all about was about vibrations. Next is the asbestos. Asbestos is the natural occurring fibers minerals that was widely used in construction, house, manufacturing and in solutions due to heat resistance, strength and the fireproof properties. However, asbestos fiber can become airborne when disturbed and if inhaled pose several other health risks like asbestos mostly affecting our lungs. Inhalation, through the inhalation we are inhaling and then it's going to stuck in our lungs. So lungs cancer is the more common cause due to like asbestos. Hazardous health hazardous of the asbestos exposure. Asbestos to controlling diseases caused to prolonged inhalation of the asbestos fibers, leading to lung scarring and breathing difficulties. Lung cancer is a serious disease with the high risk of those exposed of the asbestos, especially smokers. That will be more tough for them. Then asbestos, thousands workers die annually from the asbestos related diseases that included asbestos, lung cancer, mastectomia and pleural plug can happen. The diameter of the fibers cannot be contained by the body cells. Asbestos is used in the 3,000 products. Asbestos control. The risk of asbestos must be adequately assessed. Asbestos is the hazard. The risks are only realized when the fibers are released during the cutting, drilling, breaking and the removal. Where it is the reasonable, asbestos may be present, a sample needs to be tested by the approved laboratory prior to work being. If it is the asbestos, licensed and trained remover need to be employed to safely dispose of the material. Workers are to be informed of the risk asbestos presents and instructed to stop any work where the undefined material dust or presence. Let's see one more video for the asbestos.
Asbestos explained. Topics to be covered in this module. What is asbestos? Types of asbestos. The properties of asbestos. The uses of asbestos. The history of asbestos in the United Kingdom. Why is it so dangerous? How does asbestos cause harm? Summary. What is asbestos? Asbestos has been proven to cause life-threatening conditions such as cancer and potentially fatal respiratory disorders after long-term exposure. It is estimated that around 125 million people in the world have been exposed to the material and that it claims at least 107,000 lives a year. This has led to the banning of the substance itself in many countries around the world, including in the UK. But what exactly is asbestos? asbestos is the generic term for fibrous mineral silicates and is an element that is mined from the ground all over the world. Like most mined substances, it was created by millions of years of formation within the Earth's crust. Types of asbestos. Whilst there are actually 6 types of naturally occurring members of the asbestos family, the most common forms are known by their defining colors, as well as their mineral names. They are versatile, white asbestos. This is the most common form of asbestos and the most recognizable version. It consists of light-colored wavy fibers, usually woven together and having the same consistency as a human nail. It was used in a wide variety of ways, due to its strength. Amazite, brown asbestos. This form is more needle-like in its appearance, and usually associated with lagging and insulation. Procydolite, blue asbestos. A fluffier and softer form of the material, it was often used for coating rather than insulation. It should be noted that the color of asbestos may not confirm which type it is, as it often takes on the surrounding colors from bonding and other nearby materials. Chemical confirmation will always be required. The desirable and undesirable qualities of asbestos. Asbestos has many useful qualities when it was used in manufacturing. It insulates against heat and electricity. It is fire, water, and acid resistant. It is powerful and easily pliable. It is very light and bonds easily to other materials. Unlike most building materials, it does not degrade over time. Unfortunately, it is the very nature of asbestos that makes it harmful to the human body. The microscopic nature of the fibers means that the dust is damaging to the organs of the human body. Due to the extensive use of the substance over the years and the incredible durability of it, it remains a hazard to all those that come into regular contact with it, no matter the age or context. The uses of asbestos. The versatile properties of asbestos have lent it to many uses over the years. What was asbestos used for? Most people will know of its use in pipe flagging, fire-resistant clothing and materials, including safety curtains, roof and wall insulation, roofing felts, shingles, and tiling, strong ropes.
So that was all about asbestos. Next is the manual handling. The load lifting by the man, as we told you, as we discussed it, lifting, we have to move the any load against the gravity force is called the lifting. As manual handling the same, if we have to took some load, we have to take some things and we have to work. So that proper way should we have to take. If we have to go directly and try to pick, it will be more tough. It will be feeling pain, or lower limb disorder, upper limb disorder and backbone pain we will feel. So it should be proper way to do the manual handling. What are the manual handling actually hazard? Biggest cause of the over 3 days injuries. About one third of the reportable injuries surveyed completed in 2012 and 11 estimated the 14,001 workers suffered muscular disorder. Average work asbestos around 20 days per suffer, about 12.3 million workers days lost. So manual handling we have to do the properly, and that we have to consider according to our body weight. We can use do the our well manual handling. Like if the person have normally weight 100 kg, 80 or 75, so person can handle only between 20 to 30 kg. And once you are handling any type of the load, you should, once you are taking, you should divert your load weight little bit. You have to divert on your tummy and arms. If you are totally covering on the arm, it will be like more fastly will get tired and you will feel the pain, and maybe you lost your grip and load fell down and you get the injury. So according to your body weight, you have to use 30% of the body weight. You have to use the manual handling load percentage. So let's see one video regarding the manual handling. Before video, what are the controls regarding manual handling? Avoid the hazardous material handling by redesign the task, avoid the moving the load, automate or machines, make the assessment of the and hazardous manual handling that cannot be avoided. Assessment should be include the capabilities of people, lift, reduce the risk injury, provide the mechanical assistance, make others improvement to the risk load and the working environment. Let's see one video regarding manual handling.
We get lazy. We get complacent. We bend our spines, lift with our backs, and do ourselves a lot of damage. So, what is it that children do naturally that we should be doing? First, they get a good foundation for the lift. Children instinctively know it will be much easier to lift something with their feet apart, creating a stable base to lift from. Around hip width apart, with the load between the feet, is a good stance for lifting. Second, they keep the back as straight as possible and bend the knees to get down to the load. Since children's back muscles are not fully developed, this is the only way a child can lift a significant load. And because it doesn't put stress on the back, it's the best way for everyone to lift. Next, they get a good firm grip on the load using the whole hand, not just their fingers. Keeping the back straight, they then straighten the legs to get into a standing position.
That was the all about manual handling. So that's all for this video. Let's see you in next video. Bye bye. Take care.